Let's discuss the similarities, differences, and the clinical validity of different types of caloric stimulation. There are three different types of caloric irrigators. The open-loop water irrigator was first introduced over 7 years ago and is still in clinical use. It is based on the water flowing directly into the ear canal and transferring the heat. The Air Caloric Irrigator was introduced in the 1960s and is now the most common form of caloric irrigator in use. The air irrigators have been subject of a number of controversies regarding their reliability and clinical effectiveness. Finally, there's a closed-loop water irrigator, which was introduced in the 1980s as an alternative to open-loop water irrigator. In this method, the water flows into a balloon instead of directly into the ear canal. This system is no longer manufactured and will not be considered further in this presentation. Because of the issues surrounding the reliability of Air Calorics, ANSI, in its recommendations for caloric testing, could not reach a consensus on its use. Early studies claimed Air Calorics could not produce robust enough responses and were not as reliable as water calorics. Some of these studies, however, were based on the irrigation parameters used for water and did not use currently accepted irrigation parameters for air. Other studies showed air and water calorics were equally reliable, and differences were related to the poor technical skills of the operator. At least two recent comprehensive studies on reliability of water versus air caloric stimulation have demonstrated that although there are differences between the two methods, both types of irrigators can produce reliable caloric responses when correct irrigation parameters and proper techniques are used. The most commonly used irrigation parameters for open-loop water systems is 250 milliliters of water delivered over 30 seconds at temperatures plus minus 7 degrees with respect to normal body temperature. That's 44 degrees for warm and 30 degrees Celsius for cool. Air has a much lower capacity for temperature retention. In order to generate equivalent responses to open-loop water, air irrigation parameters should be 8 liters of air delivered over 60 seconds at temperatures plus minus 13 degrees with respect to normal body temperature. That's 50 degrees Celsius for warm and 24 degrees Celsius for cool. Comparison of water versus air calorics shows that water calorics are easy to administer. They usually generate robust responses, but they are messy and usually result in more patient discomfort. Air calorics, on the other hand, require more technical skills. They're not as messy as water, and they're more patient-friendly. Overall, both water and air irrigators can produce reliable caloric responses when correct irrigation parameters and proper techniques are used. Here are some practical guidelines to make air calorics more effective. Check the ear canal before each irrigation and remember the shape. Directing the air toward the tympanic membrane improves the reliability of air calorics. Use an irrigator head that allows visualization of the TM throughout the irrigation. When there is excessive cerumen, it's best to remove it even when the tympanic membrane is partially visible. That's because air can drive the cerumen deeper and block the tympanic membrane during the irrigation. When cerumen is to be removed, it should be suctioned or spooned out instead of using the irrigation method. That's because when the air canal is wet, warm air irrigation causes a cooling effect initially and results in nystagmus beating in the opposite direction of what's expected. For best results, use irrigators that can both cool and warm the air. Some irrigators can't cool the air and use the ambient room temperature, and that may not be appropriate for cool air irrigations.